Dengue is no longer just a seasonal fever. Over the past decade, doctors around the world have observed a worrying trend. More patients are developing severe dengue, requiring intensive care, and in some cases, losing their lives. So, what has changed? Has the virus become stronger, or are other factors responsible? The reality is that dengue has become more dangerous because of a combination of viral, environmental, and human factors. Let's begin with the virus itself. Dengue is caused by the dengue virus, which belongs to the flavivirus family. Unlike many viruses, dengue exists in four different serotypes: DNV-1, DNV-2, DNV-3, and DNV-4. When a person is infected with one serotype, they usually develop lifelong immunity against that specific serotype. However, they remain vulnerable to infection by the other three. This leads to one of the most dangerous aspects of dengue, known as antibody-dependent enhancement or ADE. During a second infection with a different serotype, antibodies produced during the first infection may fail to neutralize the new virus. Instead, they can actually help the virus enter immune cells more efficiently, allowing it to multiply rapidly. This can increase the risk of severe dengue, dengue hemorrhagic fever, and dengue shock syndrome. Another reason for the rise in severe dengue is the circulation of multiple serotypes within the same region. Many countries now experience outbreaks involving two or more serotypes simultaneously. This increases the likelihood of repeat infections and, consequently, more severe disease. Climate change is another major contributor. Rising global temperatures, changing rainfall patterns, increased humidity, and frequent flooding have created ideal breeding conditions for Aedes aegypti and Aedes albopictus, the mosquitoes that transmit dengue. Warmer temperatures also allow the virus to multiply more quickly inside mosquitoes, making them infectious sooner. As a result, dengue is spreading into areas that previously had little or no transmission. Rapid urbanization has also played a significant role. Growing populations, unplanned urban development, poor waste management, and water stored in uncovered containers provide countless breeding sites for mosquitoes. Even a small amount of clean stagnant water in flower pots, discarded tires, buckets, or rooftop tanks is enough for mosquitoes to lay hundreds of eggs. Global travel has further accelerated the spread of dengue. People infected with one serotype can unknowingly carry the virus across borders, introducing new strains into different regions. This increases both the frequency of outbreaks and the diversity of circulating serotypes. Delayed diagnosis is another important reason why dengue has become more lethal. Early symptoms such as fever, headache, muscle pain, joint pain, nausea, and fatigue often resemble influenza or other viral infections. Many people ignore these symptoms or self-medicate. However, severe dengue usually develops when the fever begins to subside. Warning signs include severe abdominal pain, persistent vomiting, bleeding from the gums or nose, extreme weakness, restlessness, and difficulty breathing. Without timely medical treatment, patients may rapidly develop shock, organ failure, or severe bleeding. Certain individuals are also more vulnerable to severe disease. Children, older adults, pregnant women, and people with diabetes, hypertension, kidney disease, or weakened immune systems have a higher risk of complications. Scientists are also studying the genetic evolution of dengue viruses. Although there is no definitive evidence that the virus has universally become more virulent, different viral genotypes may vary in their ability to spread or cause severe illness. Continuous surveillance is therefore essential for monitoring emerging strains and guiding public health responses. Fortunately, dengue can be prevented. Eliminating mosquito breeding sites, covering water storage containers, using mosquito repellents, wearing full-sleeved clothing, installing window screens, and participating in community mosquito control programs are among the most effective preventive measures. Equally important is seeking early medical attention. There is no specific antiviral treatment for dengue, but early diagnosis, careful monitoring, and proper fluid management can dramatically reduce the risk of severe complications and death. Dengue has become more lethal not because of a single change, but because multiple factors are working together. Secondary infections with different serotypes, climate change, expanding mosquito populations, rapid urbanization, increased international travel, delayed diagnosis, and vulnerable populations have all contributed to the growing burden of severe dengue. Understanding these factors is the first step toward preventing the disease and protecting communities.
Empowering future pharma professionals. Subscribe to MedPharma Global for cutting-edge insights and education.